Good day, everyone. My name is Christine Bernadette Salisi with my members Giselle Tangkilan, Chardy Moritaray, and John Dave Ogdamilan. So today, we are going to tackle or to discuss the skeletal system. So first, could you imagine a body without bones? So it would have no shape and could not stand upright. Vital organs would be almost totally unprotected, and motor movement would be impossible. Without our skeletal muscles, our bodies would have no framework. Our delicate organs would be unprotected, and we would be unable to move. Bone or osseous tissue is a hard, dense, connective tissue that forms most of the adult skeleton, the support structure of the body. The skeletal system is the body system composed of bones and cartilage and performs the following critical functions for the human body. So first, we have the protects. So our delicate organs need protection. So first, we have the skull protects the brain. Second, the vertebral column protects the spinal cord. And lastly, the rib cage protects the heart and lungs. Second is support. So our body needs a framework. So we have these three following supports. So first is the skeleton gives shape to our bodies. The second one, it holds the vital organs in place. And the third one is it enables us to achieve a good posture. Three is moves. So our muscles use our bones to cause movement. So the skeleton provides attachment for the muscles. And the second one, the skeleton is jointed, which allows the wide range of movement. And lastly, different joints allow different types of movement. The fourth one is the produces blood. So red and white blood cells are produced in the bone, marrow, the ribs, humerus, vertebrae, and femur. So clarification of bones. So the 206 bones that compose the adult skeleton are divided into 5 categories based on their shapes. Their shapes and their functions are related such that each categorical shape of bone has a distinct function. First, we have long bones. So it is a long bone that is cylindrical in shape, being longer than it is wide. Long bones are found in the arms and legs as well as in the fingers and toes. We use them in the main movement of our body. Long bones work as levers. They move when muscles contract. And the second one, we have short bones. It is a short bone that is cube-like in shape, being approximately equal in length, width, and thickness. The only short bones in the human skeleton are in the carpals of the wrist and the tarsals of the ankles. We use them in fine movement of our body. Short bones can provide stability and support as well as some limited motion. So these are the types of long bones and short bones. So in long bones, we have 2, 4, 6, 8, 9 types. And in short bones, we have 2 parts. The first one in the long bones is the humerus, radius, ulna, metacarpal, metatarsal, phalanges, femur, fibula, and tibia. And in short bones, we have tarsals and carpals.
Flat bones. A flat bone is typically thin. It is also often curved. Example include the cranial skull bones, the scapulae, shoulder blades, the sternum, breastbone, and the ribs. We use them to protect the organs of our body. Flat bones serve as points of attachment for muscles and often protect internal organs. Irregular bones. It is an irregular bone that does not have any easily characterized shape and therefore does not fit any other classification. These bones tend to have more complex shapes, like the vertebrae that support the spinal cord and protect it from compressive forces. We use them to give our body protection and shape. Many facial bones, particularly the ones containing synostomes, are classified as irregular bones. Sesamoid bones. A sesamoid bone is a small, round bone that, as the name suggests, is shaped like a sesame seed. These bones form in tendons, the sheaths of tissue that connect bones to muscles. where a great deal of pressure is generated and point. These bones protect tendons by helping them overcome compressive forces. These vary in number and placement from person to person, but typically found in tendons associated with the feet, hands, and knees. The patellae, singular patella, are the only sesamoid bones found in common with every person. Table 1 reviews bone classification with their associated features, function, and examples. How do we move? The skeleton has many joints. A joint, also called an articulation, is any place where adjacent bones or bone and articulate come together, articulate with each other to form a connection. There are two classifications of joints: structurally and functionally. Structural classification of joints take into account whether the adjacent bones are strongly anchored to each other by fibrous connective tissue or cartilage, or whether the adjacent bones articulate with each other within a fluid filled with space called a joint cavity. Functional classification describe the degree of movement available between the bones, ranging from immobile to slightly mobile to freely movable joints. Immovable joints, a formulation of two bones that have been fused together. Such joints are capable of movement by muscular force. For all practical purposes, they could as well not exist, except that they do serve a protective function. Slight movement might occur in the joints, resulting in cushioning effect when external force is applied. For example, if a blow is struck on the head, the immovable joints of the cranium will permit slight movement.
Slightly movable joints. These joints are not firmly fixed as are immovable joints, but the structure of bones and connective tissues in and around the joints restricts the range of motion to only a few degrees. Examples of slightly movable joints are those located in the spine. It is also found between the sacrum, iliac, and at the front and back attachments of the ribs. Free movable joints. These joints have a comparatively large of movement and are of prime importance in a motor performance. They are located in the upper and lower extremities. Examples of freely movable joints are the shoulder, elbow, wrist, hip, and knee joints. Joints and sports. When we make skilled sporting movement, our different joints to work smoothly together in order to work well, they must be capable of a full range of movement. To give stability to the joint, the muscles and ligaments surrounding each joint must be strong enough. The demands of sports place severe stress in our joints. We must warm up thoroughly before activity and we should cool down afterwards. Joints can be injured as a result of impact, internal forces, or a mixture of both. Common examples include sprained ankle, torn knee, ligaments, and dislocated shoulder. Planes of the body. The sagittal plane is a vertical plane extending in an anteroposterior direction, dividing the body into right and left parts. Effectively, the forward and backward plane, sagittal plane is any plane parallel to the median plane. The coronal or frontal plane is a vertical plane at right angles to the sagittal plane that divide the body into a anterior front and a posterior back portion, effectively the side movement plane.
About the kinds of joints movements. So the following are description of all the movements that occur in a body. body joints that description are based on an assumption that the body is in the standard anatomical position. That is the rack position with the palms forward. So the first one is the flexion. Bending is a movement of a segment of the body causing decrease in the angle at the point such as the bending the arm at the elbow or the leg at the knee. The trunk and the neck can flex forward. Number 2 is the lateral flexion is bending sideways. And it can occur to both right and left. The trunk and neck can also flex sideways. The third is horizontal flexion. It's a body segment flexes through the horizontal plane. For example, the arm moves through horizontal flexion at the shoulder joint in throwing the discus or in the side arm pitch. Number 4 is the dorsiflex. So it's when the ankle is flexed, causing the foot to draw closer to tibia. Number 5 is plantar flexion. It's the opposite movement at the ankle. So the second one is extension. It's the movement in the opposite direction of flexion which causes increase in the angle at the joint, such as straightening the elbow or the knee. Number 7 is the horizontal extension. Occurs when the body segment extends through the horizontal plane. In the patting, the shot opposite arms move through the horizontal extension. Number 8 is the hyperextension. It's an extension of a body segment to position beyond its normal extended position, such as arching the back of extending the leg at the hip beyond its vertical position. So the movement is limited by the strong interior cruciate ligament. Then number 9 is abduction. It's a movement of a body segment in the lateral plane away from the midline of the body, such as raising the leg or the arm sideways. Number 10 is adduction. It's a movement of a body segment toward the midline, as moving the arm from the outward horizontal position downward to the vertical position. Number 11 is rotation. Is a movement of a segment around its own longitudinal axis. A body segment may be rotated inward or outward. The scapula may be rotated upward or downward, and the spine may rotate to the right or the left. Number 12 is pronation. It's a rotation of the hand and forearm downward, resulting in a palm down position. Number 13 is supination. It's a rotation of the hand and forearm upward, resulting in a palm up position. Number 14 is inversion. It's rotating of the foot, turning the sole inward. Next one is the number 15 is the eversion. It's a rotation of the foot, turning the sole outward. 16 is the circumduction. It's a circular or cone-like movement of a body segment, such as swinging the arm in a circular movement about the joint. The kind of movement is also possible in the wrist, trunk, neck, hip, shoulder girdle, and ankle joints. Number 17 is elevation. It's when the shoulder is lifted upward as in shrugging the shoulders. Number 18 is depression. It's when lowering of the shoulder girdle. Number 19 is protraction or abduction. It's a movement of the shoulder girdle away from the midline body, resulting in a broadening of the shoulder. Number 20 is retraction. It's a movement of the shoulder toward the midline of the body, resulting in a narrowing of the shoulders. So the clavicle is capable of some rotation at the sternum and accompanies scapular upward and downward rotation.